Hello, my name's Tonya. I'm a personal trainer and a mum of 5. This is my podcast, Live Yourself Better, and it's for busy people just like you. Hello, how are you? Thanks for joining me. Today I'm going to be talking all about anxiety. What is anxiety and how can it impact on our ability to exercise and engage in physical activity? And what things can we put into place to support ourselves through these situations? Also useful if you're working with people with anxiety. It's not always easy to know how to support people. And of course, there is no one size fits all. So we will touch on lots of different aspects. Stay tuned. Firstly, it will be helpful to define what do we mean by anxiety. The NHS definition is anxiety is a feeling of unease, such as worry or fear that can be mild or severe. Everyone has feelings of anxiety at some point in their life. For example, you may feel worried and anxious about sitting an exam or having a medical test or a job interview. During times like these, feeling anxious can be perfectly normal, but some people find it hard to control their worries. Their feelings of anxiety are more constant and can often affect their daily lives. And then it goes on to explain anxiety is the main symptom of several conditions. So we have panic disorder, phobias such as agoraphobia or claustrophobia, post-traumatic stress disorder, PTSD, and social anxiety disorder or social phobia. So to give a brief definition of each of those conditions, and please do refer to the nhs.uk for more information on each of these topics. So generalised anxiety disorder is a long-term condition that causes you to feel anxious about a wide range of situations and issues rather than one specific event. People with generalised anxiety disorder, GAD as it's abbreviated, feel anxious most days and often struggle to remember the last time they felt relaxed. As soon as one anxious thought is resolved, another may appear about a different issue. Panic disorder is an anxiety disorder where you regularly have sudden attacks of panic or fear. So this can include feelings of anxiety, stress, panic regularly at any time and often for no apparent reason. The symptoms of panic disorder are anxiety and panic attacks. Phobias. A phobia is an overwhelming and debilitating fear of an object, place, situation, feeling, or animal. Phobias are more pronounced than fears. They develop when a person has an exaggerated or unrealistic sense of danger about a situation or object. If a phobia becomes very severe, a person may organise their life around avoiding the thing that's causing them anxiety, as well as restricting their day-to-day life. It can also cause a lot of distress. Post-traumatic stress disorder, often abbreviated to PTSD, is a mental health condition caused by very stressful, frightening or distressing events. Social anxiety disorder, also called social phobia, is a long-term and overwhelming fear of social situations. It's a common problem that usually starts during the teenage years. It can be very distressing and have a big impact on your life. For some people, it gets better as they get older, but for many people, it does not go away on its own without treatment. So those are the main types of anxiety as defined by NHS UK. Of course, there may be crossover between the different types, and you might be experiencing something that doesn't fit neatly within any of those parameters. So it's really important for me to start the episode by emphasising the NHS advice, things you can try to help with anxiety, fear and panic. It says you should try talking about your feelings to a friend, a family member, health professional or counsellor. You could also contact the Samaritans 116 123 or email Jo at Samaritans SAMARITANS.org if you need someone to talk to. Use calming breathing exercises. Exercise. Activities such as running, walking, swimming and yoga can help you relax. Find out how to get sleep if you're struggling to sleep. Eat a healthy diet with regular meals to keep your energy levels stable. Consider peer support, where people use their experiences to help each other. And there's actually peer support on the Mind website. Also, you can listen to free mental wellbeing audio guides. Now, I'm going to pop a link to this in the comments of the episode. So please take a look there for further information and do follow the advice. This episode is designed to explore anxiety and exercise and fitness. It is not, however, a substitute for medical advice, so please do consult your healthcare professional or a trained therapist or counsellor for support. So, as I mentioned earlier, I have anxiety, and specifically generalised anxiety disorder, but I have had elements of social anxiety as well, and this is something I can't really remember ever not feeling anxious. It was something that I experienced throughout childhood, throughout my teen years, and in fact it wasn't until I got into my 30s, or maybe turned 30, that I had support for it, and that was through speaking to my GP, and then I was referred onto an NHS CBT, cognitive behavioural therapy course, and I have done other types of therapy as well over the years. I have also done CAT therapy, which is cognitive analytical therapy. Again, that was something that I was referred to by my GP, or it may have been a self-referral actually, because there's some things you can self-refer to talking therapies. And so in some ways, just acknowledging those things. And I know that people say labels can or may not be helpful, but personally for me, being able to give it a name was such a huge relief, because you suddenly go, wow, this isn't just me. I'm not strange. I'm not just worrying. Actually, there's something else going on, and I need to understand what that is in order to be able to work out what support that I need. But the one thing that I knew was I cannot live the rest of my life feeling like this. I need to understand management strategies, coping techniques. I'll do anything. I was at that point. I'll try anything. And, you know, some of those things have been really helpful. It is something I constantly have to work at. It's not that you go on a course and it's solved. It's learning what strategies work, how and when to implement them, and also learning when the signs are there that things are getting difficult. And that can be a difficult one to spot, you know, when we're caught up in stress, when we're caught up in the patterns of life. So, you know, I'm a big advocate for reaching out and speaking about it. But this really is the first time that I've spoken about this so openly publicly. I have alluded to it on the social media. And one of the reasons for that is recently I qualified as a GP exercise referral instructor. So how do we exercise when anxiety holds us back? Well, we know the benefits of exercise. It can boost the mood, improve physical health, improve well-being. And yet, where anxiety is present, that first step onto the gym floor or going outside the house for a run can feel like a huge leap. In fact, doing anything that's different from routine, that might create change, that might create that challenge, can actually send somebody's thought processes into a spin of fear. And there are some common hurdles that can be fear of judgment, especially where social anxiety is present. That gyms can be hugely intimidating, and you might be concerned about people staring at you or critiquing your form, or not doing something properly. And the pressure of that can increase actually when people feel like all eyes are on them. It can mean they are less likely to perform something correctly. The physical anxiety, the panic attacks or just general anxiety, can cause physical symptoms, shortness of breath, dizziness, palpitations. And of course, all of those things can be incredibly scary anytime, but most especially during exercise, when our body systems are working harder, when we're raising our heart rate, when we're having to work harder breathing. It can be difficult to distinguish between what is induced by exercise and what is induced by fear and panic. And that can really be a deterrent to people, especially people who feel anxiety and fear, because sometimes the body responses to intense exercise can mimic the body responses in some ways to the fear and panic. So there's almost that resistance of, do I want to feel like this today? It's understandable that that can be a barrier. Also, anxiety can impact on motivation. So you can be left with no energy or enthusiasm for physical activity, especially if your sleep patterns are disturbed and you're not getting enough rest, or if you're constantly on high adrenaline, you're constantly in a state of high alert. It's possible that you might experience times when you just crash because you've used so much energy in maintaining that anxiety and worry and that hypervigilance. And of course, that's not an exhaustive list. There will be things that are personal, that are unique, that relate potentially to trauma. People may not want to revisit a feeling of intense exercise because it may trigger a previous past experience. And I will talk more about trauma and exercise in an episode later on this year. So do look out for that, because it's a huge topic and I think it's one that's so often overlooked. And as are many health conditions, it's all very well saying do more exercise, eat less, drink less alcohol. And I think those things are great advice. Don't get me wrong, they are great advice. But what is very, very, very often missing is the how and the why do we not do those things, and why do we seek out the alternatives which are not beneficial to health. There's so many complex things going on for so many people, which is why a very simple polarised approach, do this or don't do this, is not helpful. And I think it sometimes comes from places where people haven't experienced those challenges. And actually, I'm not saying that it's not possible. Of course it's possible. I firmly believe that change is possible for all of us, or I wouldn't be doing this. But it's how we approach it and what things we consider. What you consider for yourself and what I, as your trainer, consider for you as a client. And those things and your ability to perform them and manage them will determine the long-term chance of success. So, what are some practical tips that we can put into place to break this anxiety exercise cycle? Well, start small and celebrate your progress. There's no point in trying to run a marathon from being seated on the sofa. It's not really going to happen overnight. You need to make sure that you have realistic goals set and try not to compare yourself to others. Avoid anything shame-based that's telling you you shouldn't do this or you shouldn't do that. I would say look for instructors that understand the challenges that you're facing and really embrace that approach. You may be able to get a free session with an instructor to trial out their services or to meet with them beforehand, and many instructors will not mind you bringing a family member or friend along to support you. Find activities you enjoy locally, and exercise shouldn't feel like a punishment, so explore activities you find fun. Perhaps try something new, and if you're doing that, it's not beyond the realms of someone with anxiety. If you listen to my episode about wild swimming, you'll hear how I run through all of the things. Have I got everything I need? All of my fears about going into the open water. But I did it. And it's important to put safeguards into place so you can contact venues and organisations by email if you find it easier than phone. Actually, sometimes email's easier because on the phone it's not always easy to remember what someone's telling us, especially if we're feeling anxious. So ask the questions beforehand. You can even ask a venue what support they might have in place for someone with anxiety, or whether there's anybody there that's trained to support you. But there may not be, of course, and in which case it's asking what you need. What do you need from the venue? In terms of the gym, many people have a huge fear of going into the gym, joining a gym, people looking. I often say to clients, people aren't looking at you. They're generally, they'll look at themselves. They're looking at their form, or they're looking out to see whether a piece of equipment is free, or we don't really ever know what other people are looking at. We can't be inside someone else's head, but of course the fear is huge. And there are gyms that have apps that tell you how many people are in the gym at any one time, so you can choose to go at a quieter time. For those that don't, you could ask the question, and again by email if that is easier. There are usually trial sessions available, trial periods. Some gyms will even offer you a free pass. And again, take a friend, take someone to support you. Make sure you have a proper induction with a qualified instructor. These are usually free and part of the service for a gym. You shouldn't have to pay to be shown how to use the equipment correctly, because this is how you perform the exercises safely. There are also gyms that offer, for example, ladies only gyms. So some ladies, they don't like to lift weights in spaces with men, and they prefer to be in female only spaces. You can achieve that because there are always provisions locally, and sometimes there are classes that are specifically for certain groups. So always ask the question. A good gym and a good trainer will answer your questions, and be prepared. There may be some times when you do not get a reply, but do not be off put by that. Just try another one, try another facility. There are plenty of gyms, there are plenty of trainers. You might wish to consider online workouts. So I offer online workouts. There are many personal trainers who also do. Just explore, see what's out there. Look at whether you can get a free session or to meet with them beforehand and get to know how they work and what their understanding is of supporting you with your condition. The other option is home gym. So if you have gym equipment at home, you can get second-hand gym equipment online. Sometimes people give it away locally. Just be cautious to check the safety of any equipment that you're getting second-hand. And make sure that you are happy with using that. There's no use having a second-hand workout bench or exercise bike that has like loose screws on it or something. So do be wary of that. You may wish to buy first-hand for that reason. Or some personal trainers will bring gym equipment to your house. And certainly I do that. I bring the gym to people, and there are people who do not wish to leave their home. They are not prepared or ready to go to a gym. Some people do not ever wish to set foot in a gym. That is okay. None of this is saying you have to do. And also for some people who have children, small children, for example, they can't get out to go and do those things very easily. Now, there are classes as well locally that you can take children to. Even with babies, you can do yoga with babies, I've noticed locally to us. So always look out. Google is your friend, but also sometimes you'll get recommendations on the local authority website, and they will signpost you to reputable organisations, as well as just asking on local neighbourhood groups for recommendations. It's always good to have a recommendation from someone who's experienced the service. The other thing is listen to your body. So don't push yourself too hard, especially if you're new to exercise. Make sure to take rest days and pay attention to your body's signals. Also, it's good to incorporate a form of relaxation. So yoga, meditation and Pilates, all of these things can be very stress relieving. And I always recommend that clients incorporate something into their routine that helps to relieve stress. Because instead of simply saying to people, eat less, don't have snacks, don't eat the chocolate, what we're looking at is the reasons why. Why is this a solution for something for us right now? What is triggering this? And how can we perhaps address that trigger? Because it's absolutely no good just saying don't drink alcohol. Well, right, okay. That's helpful when someone is potentially reaching for a glass of wine at a time of stress. But also I just want to caveat by saying, please do seek professional help. If you have any issues with substances, if you feel that it's not going to be possible to address certain habits without that professional support, if anxiety is significantly impacting your daily life, then if you seek help from a healthcare professional, a therapist, a counsellor who specialises in anxiety disorders, they will help to equip you with coping mechanisms and strategies to manage your anxiety and improve your overall well-being. We needn't be on our own. There are so many resources out there that it's in abundance. The key is reaching out and asking for that help. That brings us to the end of the episode, and I just want to say thank you for listening. And where you are experiencing anxiety, don't be afraid to reach out, and also to understand that it is possible for you to engage with exercise and physical activity, and these things really can improve our mood and become a coping strategy to reduce stress when combined as well with other elements that relieve stress, such as yoga, mindfulness, therapy. It's possible to live a healthy and full life with anxiety. And some additional resources, and some that I have used in the making of this episode, include mind.org.uk, the National Institute of Mental Health.gov, that's a US site, and as is the Anxiety and Depression Association of America. There is also Anxiety UK. So I will put the links to these in the episode description, and wishing you a happy and healthy time exercising. See you next time. Take care. You can find my website, liveyoubetter.biz. That's live, LIVEUYOU, better, BETTER.BIZ. On there, you'll find links to all of my social medias, information about me, how we can work together, and you can also subscribe to the website by email to receive exclusive offers, newsletters, and updates from me. See you soon.